Okay, let's dive into this explainer. We've all been there, right? You go to the doctor, they draw a little blood, and a few days later, bam! You're handed this piece of paper packed with numbers, acronyms, and totally intimidating scientific jargon. Well, today, we're going to treat your complete blood count, or CBC, like a medical crime scene. We're going to decode exactly what those lab results are actually saying about your health, your lifestyle, and, most importantly, how they validate the very symptoms you might be reporting to your doctor.
Now, what's really fascinating here is that those tiny abbreviations on your report, they aren't just random letters. They're actually critical, microscopic clues that point directly to your daily habits and underlying conditions. When evaluating a CBC with patients who report symptoms like, say, exhaustion or weakness, this report is literally the very first place a doctor looks. Think of it as the ultimate map to your biology.
So here's our quick roadmap for today. First, we'll cover the broad CBC diagnostic clues. Second, MCV, where we size up the cells. Third, MCH, looking at the hemoglobin payload. Fourth, microcytic anemia. And finally, number 5, macrocytic anemia.
All right, moving right into Section 1, the CBC Diagnostic Clues, uncovering your blood's hidden messages.
And zooming in to Section 2, MCV. This is where we size up the cells and measure the delivery trucks.
To make this really simple, I want you to think of a red blood cell as a microscopic delivery truck driving through your veins. MCV, which stands for mean corpuscular volume, tells us the exact physical size of those cellular delivery trucks. Now, the normal range you want to see on your report is between 80 and 100 FL. When a patient's report lands right in this sweet spot, we call it normocytic, meaning perfectly normal-sized trucks. But here's the kicker. A patient can actually still be anemic even if their cells are the exact right size.
Right, so if a patient's cell size is perfectly normal, falling right in that 80 to 100 range, but they are still anemic and reporting symptoms like extreme fatigue to their doctor, medical detectives have to look at 3 major culprits. We're talking chronic disease, kidney disease, or acute blood loss. Basically, the delivery trucks are fine, but the factory is either under attack or there's just been a massive loss of the fleet due to bleeding.
And this brilliantly illustrates how medical students actually study this exact science. You get to see authentic revision notes, visually mapping out the exact pathways of MCV and MCH. It translates all that complex medical science into really relatable concepts and perfectly structures what happens when those cells go out of their normal range.
Which brings us to Section 3, MCH, the hemoglobin payload. Let's look at exactly how much cargo is inside. Okay, so if MCV is the physical size of the truck, we now need to zoom in even closer. 27 to 33. This represents the normal range in picograms for MCH. It's the baseline number we use to measure your cellular cargo health. If your number falls right here on your lab report, your cargo levels are completely healthy.
So MCH stands for mean corpuscular hemoglobin. This measures exactly how much oxygen-carrying cargo is packed inside each individual red blood cell. Essentially, we're just asking how much hemoglobin is actually in each cell. If this cargo is low, the patient simply isn't getting enough oxygen throughout their body, and that is exactly why they report symptoms of being out of breath or constantly tired.
Let's move on to Section 4, microcytic, small and pale. This is what happens when trucks shrink and cargo drops.
You know, the absolute best way to decode this medical terminology is by comparing opposites. We're going to look at cells that have physically shrunk way down versus cells that have dangerously ballooned in size. Both situations create highly specific problems for the patient.
Let's start with the small ones. In microcytic anemia, the MCV on your report drops below 80. The red blood cell literally becomes abnormally small. When a doctor sees this tiny cell size, they immediately know the body is lacking the raw building materials needed to manufacture proper delivery trucks. The top suspects here? Iron deficiency and a condition called thalassemia.
Let's look at how this physically plays out in a patient. This logical cascade shows exactly how a lack of dietary iron affects your blood. Step 1, iron deficiency occurs. Step 2, because there isn't enough iron, way less hemoglobin cargo is packed per red blood cell, causing your MCH levels to drop. And step 3, the red blood cell structurally becomes small and what we call hypochromic, meaning it literally looks pale under a microscope. Small, pale cells equal a patient reporting profound exhaustion to their doctor.
Moving right along to Section 5, macrocytic. Large and overloaded. This is when cells balloon in size.
So, looking at the flip side of the coin, in a macrocytic state, the cell size shoots right past that upper limit of 100 on your MCV report. The red blood cell gets massive, and because the physical delivery truck is bigger, it often carries a hyperchromic, completely overloaded payload of hemoglobin, which actually causes the MCH metric to increase. Now, you might think bigger is better, right? But actually, no. These giant cells are incredibly inefficient and prone to early destruction.
When a patient presents with these giant cells, the medical detective work shifts dramatically. What's super fascinating here is how patient lifestyle factors and chronic conditions directly trigger this cellular swelling. Doctors are going to look for deficiency in vitamin B12 or folate. They'll check for liver disease like chronic hepatitis or cirrhosis. They will evaluate for alcohol use disorder, and they'll check for hypothyroidism.
Let's quickly trace the vitamin B12 pathway. A patient suffering from pernicious anemia, poor dietary intake, or a malabsorption issue in their gut is going to follow this exact three-step cellular transformation. Step 1. The B12 deficiency takes hold. Step 2. Without B12, the cells literally can't divide properly, so they stay abnormally large, becoming macrocytic. Step 3. Because they are so incredibly large, the MCH level, that hemoglobin payload, increases, making them hyperchromic.
Let's touch on a really vital point about lifestyle. It's a surprising fact that excessive alcohol consumption alone can act as a direct culprit in reshaping your biology. Alcohol use disorder often causes larger red blood cells, even without the presence of liver disease. Yep, alcohol is literally ballooning your cell size, and it's something your doctor can spot right there on the CBC report.
And finally, hypothyroidism, or a lack of thyroid hormone, is another major patient condition directly associated with macrocytic anemia. A sluggish thyroid slows down the body's systems, and it's absolutely another critical piece of the puzzle that medical detectives look for when they see that MCV number climb over 100.
So we've gone from the raw lab report to the microscopic delivery trucks, down to the hemoglobin cargo, and finally to the dietary and lifestyle choices that pull all those levers. The next time you look at a blood report, remember, these aren't just random numbers generated by a machine. They are a direct physical reflection of your life, your habits, and your health, which leaves us with this final thought to ponder. How are everyday factors like your diet and alcohol use silently reshaping your microscopic biology right now? Thanks for joining me on this explainer. I hope you never look at a CBC report the same way again.